Good morning, I'm Elijah Winfrey. Joining us this morning is Dr. Gaboriau from Adirondack Health. Good morning, doctor. How's it going?
Good morning. Thank you for having me on your show. We're doing pretty well here. It's a beautiful day.
Dr. Gaboriau, we're here to talk about National Dog Bite Awareness Week. We certainly will be getting to that here in a second, but that's an area where you kind of have expertise in as far as repairing and doing surgery on folks who have had bites from dogs, right?
That is correct. Yes, absolutely.
From what I understand, you were also on a TV show, a Animal Planet TV show called I Was Bitten. Tell us a little bit about that experience.
Yes, it was a Discovery Channel, in fact, and one a patient in Seattle got really badly mauled by a dog during her work, and the patient contacted me. In fact, the hospital contacted me to see if I could do some reconstructive surgery on her, which of course I accepted. And then later on, the Discovery Channel, truly I don't really know how, but they became aware of the case, and they contacted my office and wanted to interview the patient and myself regarding the reconstructive surgery and how we did proceed, and what type of technique we used to be able to reconstruct her face.
Okay, and obviously you were able to do that successfully, right?
That is correct. Yes, we end up being able to almost erase the scars. She had multiple scars on her face, and at least give her back her face, basically.
I forgot to, kind of let you introduce yourself and tell us a little bit about where you're from. I'm picking up on an accent.
That is correct. Yeah, originally I'm from France. Came to the U.S. back 1989, and then I ended up going to Tulane in New Orleans for my residency in otolaryngology, and then after that I did a fellowship in facial plastic and reconstructive surgery at the University of Washington in Seattle. And I ended up spending pretty much 20 years doing plastic and reconstructive surgery in the Pacific Northwest until I came to the Adirondack at Adirondack Health about a year ago.
All right. Well, we certainly are glad to have you here in the North Country. And you kind of talked a little bit about your, things that you specialize in. But if you can, just tell us a little bit more about some of your specialties.
So my first board certification is otolaryngology. It's, better known as ENT, ears, nose, and throat. And then I decided to subspecialize more into the plastic and reconstructive. And what that encompass is all the plastic that people heard about, facelift, nose job, neck lift, and also the Botox and the fillers, all the beauty aspect of surgery. But there is also another part, which is all the reconstruction, and that is after facial trauma, car accident, dog bites, but also, and it's not very well known, but we do the reconstruction after skin cancer. The skin cancer is increasing every year. The numbers are increasing. Cases getting more complex. So part of our training is to be able to remove these cancers and reconstruct their defect in a way to make it as cosmetic as possible.
Dr. Gaboriau, obviously, we're here to talk about National Dog Bite Awareness Week. I was told this is something that you're very passionate about, not just because it's what you do, but also, just the topic in general. What makes this so interesting to you, something that you're very passionate about?
When we look at numbers, the majority of dog bites are going to happen in kids. Usually it's the face, can be also the hands, but usually it's the face. So it's, of course, it's an area that I like to start with, which is the face and any type of reconstruction. And then, it happens in kids. So I think we need to address that, and we need to take care of that right away, because they're going to grow up with horrible scar if we do not. So I'm passionate because not only it's reconstruction, but also it's on kids.
Dr. Gaboriau from Adirondack Health. He's joining us this morning to talk about National Dog Bite Awareness Week. Do want to, thank the doctor for taking a little bit of time to talk with us this morning. And Dr. Gaboriau, when you hear dog bite, your mind always thinks of the worst, but there are bites that are small that still need to be repaired, correct?
That is correct, and you're right. Whenever I get a phone call from an ER saying we have a dog bite, I'm always ready to facing something pretty drastic, like part of the nose is gone, part of the lip is gone. But what we have to understand is that is not the majority of cases. The majority of cases are going to be what we call a puncture wound, where the dog did not a bite, but almost like nipping at the cheek of a kid. And unfortunately, what I've seen over the years is a lot of parents feel, okay, it's not too bad, it doesn't bleed that much, and then they don't come to the ER, they don't come to see us, and then later on, we have a bad scar. Not only you can get infected later on, and also you can have a very bad cosmetic result. So my advice is, it doesn't matter the size, even if it's a small nipping, please come to the ER. We can clean the wound, we can make sure there's no infection, then we can call me, we can look at it, until we can start doing some local wound care on these little bites to try to get a very good result later on.
Do you believe that, one reason why families might not come forward is simply because, they love their dog and this was out of behavior for the dog and they don't want the dog to get in trouble?
It's a good question. It is known that the majority of dog bites happen with the family dog. Mm-hmm. So I think there is a concern that, if they bring that to the public, that people are going to start looking at their dog differently. So I think there is that fear. But also there is that, that I don't like to call it denial, but almost like, okay, it's a small thing. There is no bleeding. Mm-hmm. So why do we go to the ER? We're going to have to wait. We don't know what the bill is going to be. People, they need to think about that, and they don't come, and then they end up having a bigger problem later on. So I think there's two reasons why they don't come. One is maybe out of shame, and the second one is they really think it's not that big of a deal, and of course the cost associated with that.
Okay, and again, folks, we do have Dr. Gaboriau from Adirondack Health joining us this morning. Dr. Gaboriau, how many dog bites have you fixed in your career?
That's a very good question. I started doing it back in '99, so it's been over all these years. I don't know how many. I would say if we look at very large one, major reconstruction of nose, lip, cheeks, eye, maybe a dozen of them. But when we start looking at a smaller one, I don't want to say in the hundreds over 20 years, but, it could be close to that.
Are there any reconstructions that stand out in your mind?
Yes, two of them, in fact. The one that I was featured on in Discovery Channel, because that was really a lot of tissue on that lady, different part of her face. Nerves was one of the nerve was unfortunately severed, and the other one was a lip on a little kid, and she lost the upper lip, part of the upper lip. So these are two different type of skills. The first one, I had to bring some foreign material. We call that the name for xyloderm, which is basically cadaver skin, to be able to reconstruct what she missed on part of her forehead. And for the little girl was how to do what we call a skin flap to be able to reconstruct her lip, so can later on can still use her her mouth to talk and smile. And so these two cases really stand out of my mind as the most challenging that I've done.
Dr. Gaboriau, one thing I was thinking about as you were just talking was the fact that doctors usually see us, their patients, at their very worst. Obviously folks are normally not going to the hospital just because, or going to see a doctor just because, but how great is that feeling when you're able to help somebody get back what they've lost?
It's, I think that's the part of the reconstructive side of my practice that I love. And that is for me really, really satisfying when I see a patient especially a kid. I mean, don't take me wrong. I love working on adult too, but especially a kid when they come in and they don't know what happened. They don't understand why. They don't understand why they lost part of their cheek or lip. And then you do the reconstruction and they come back 4 or 6 months later, you barely can see the defect. And they're happy, they're smiling, and that for me is the biggest reward.
Dr. Gaboriau from Adirondack Health, and he's been joining us all morning long to talk about National Dog Bite Awareness Week. And Doctor, one thing that we haven't gotten to yet, which my fault, but I definitely want to fix that right now. How can people prevent dog bites?
It's a very good question. First, I think, as I've said earlier, the majority of dog bites happen with the family dog, and especially with kids, little kids. One of the things is to avoid that these little kids to come too close and especially to surprise the dog. And I've seen that over and over my career of these poor kids. They're playing, the dog is asleep, and they jump on the dog. And it's not the dog's fault, it's his reaction, turns around, a little bite. Or the kids come and they play around the dog that he's eating. So that's another thing. So what I would say is be careful when you have little kids around your dog to just make sure that these little kids know not to surprise the animal. And none of us wants to be, caught by surprise. Mm-hmm. So I think that's the biggest thing is never leave a little kid by himself or herself with your dog, because you never know, even if it's not out of malice that the kid is going to play either rough with the dog or surprise the dog. But I think it's just make sure there's always an adult whenever there is a little kid and a dog.
You just hit on something that I was thinking about, which is, kids playing rough with the dog. Obviously, they don't know how rough they're playing, but, the dog could take that the wrong way, I guess is the way to put it. Any prevention tips there?
It is true. That's always have an adult supervision. It's like always we always say that, any type of a dangerous tool, dangerous toy, is just that an animal is not a toy, and we have to respect the animal. We have to respect his or her space also. And I think it's the thing is to realize that, is to be always together and teach the kid not to be rough with the animal, maybe teach the animal, not to be rough with the kid, Mm-hmm. I grew up with 7 dogs, so I know how, rough we can play with them, and sometimes we forget that they are an animal.
Dr. Gaboriau, if somebody is following the prevention tips but still something happens, what should they do?
I would absolutely, first thing is, if there is, of course, any bleeding, they need to put something on the wound. My advice is don't try to clean the wound yourself, please, except if you're far away from any medical center, any urgent care, ER, then you can do it. But my advice is put a nice dressing on it, clean dressing, and come right away to the ER. This is what I would do. The other thing is, if it is your own dog, then if the dog has been vaccinated, make sure that it's up to date. Now, if you do not know the dog, then you need to get the information, because we need to know, does the dog got the rabies, vaccination, all of these things. This is for the safety and the health of the victim. So if it's your own dog and you know that it's been covered entirely, there's no problem there, but you can bring the victim right away to the ER. I would not wait. And that is going to be, the timing is extremely important. Don't wait 12 hours. Don't wait 24, 48. Please bring the victim right away to the ER so we can take care of them.
Dr. Gaboriau, as far as folks here in this interview, you never know who's listening on radio. So if folks have questions that I didn't ask you that they want to ask you, how do they get a hold of your office, and what's going on as far as your office is concerned in this pandemic? As far as, are people able to walk in, or how does that work?
Absolutely. It's I'm pretty sure you know that Adirondack Health is very, very good at keeping all their patients safe and the staff safe too, and all the rooms and everything are cleaned regularly. So I don't want, that's one thing. Please don't be afraid to come and see us. And my office, if something happened emergently, please go to the ER. They will get in touch with me, and then we can take it from here. Now, if there's something happened and you passed the emergency part of it, and you want to contact my office, if it's okay to give the number of my office,
yes.
Yeah, so the phone number, and it will be direct. You will talk to my clerk, and it is 518-891-0563. And please, even if you know somebody or you have experienced a dog bite that has been years ago, please give us a call. Come, we can take a look. And the reconstructive part doesn't have to be, done emergently. We'd rather do that. But, it's not because it happened a few years back. Please come and we can take a look and see what we can do.
All right, Dr. Gaboriau. Well, before we wrap things up, I do want to give you the floor here. Anything else that folks should know or consider here as we observe and bring awareness to National Dog Bite Week?
I would say, please respect the animal, respect their space. I've seen too many times walking on the street, a little kid wants to touch the dog because it's a cute dog, and the first thing they do, they put their hand out, the finger to the dog. Please don't do that. You don't know. You don't know if the dog is skittish. Maybe he's going to be afraid. You don't know that. So please, make sure you take care of your kids. Make sure you are in between you and the dog. Make sure you ask the owner of the dog, is your dog friendly? Can we pet the dog? And but please don't put your finger straight or your face straight to the nose of a dog, because this is what we see. A lot of the incident happen that way.
All right, Dr. Gaboriau. Well, we greatly appreciate all of your time and all that you do for our community. Again, we have been talking with Dr. Gaboriau from Adirondack Health. Doctor, stay safe out there.
Thank you, and I appreciate your time, and thank you for having me on your show.